possibly their first symptom of diabetes is a heart attack when they go to the emergency room, and the doctor in the emergency room says to them, did you know you have diabetes because your glucose level is high? And the person said, I didn't even know that. But you know what? It's all those years of the high level of insulin pumping out that contributed to their heart attack, because insulin itself is an atherosclerotogenic agent. In other words, insulin itself promotes atherosclerosis. It accelerates the rate at which the body lays down plaque on the inner wall of the blood vessels. So even though they're just recently diabetic, they're suffering from the effects of diabetes years before they ever become diabetic. When you're overweight, the heightened insulin is an increased risk factor for heart attacks. So now, what do we do to this diabetic? Do we give them more insulin? They're already producing too much insulin. They're already suffering from the effects of too much insulin. And we give them even more insulin to lower their glucose. But the high glucose is not good either. That causes other problems, like we glycate proteins. The glycolation of proteins in the cells age our kidney, causes eye damage, can cause circulation and nerve damage. In other words, our bodies are going to age much more rapidly and create diabetic complications that are deadly if we don't lower those glucoses. So we're stuck. Doctors are stuck between, what do we do? Give them more insulin or drugs to lower the glucose? Give them more insulin to lower their glucose? Sure, it's very hard to treat this because the drugs sometimes aren't strong enough to get the glucose down, so they're left in a position of giving diabetics insulin, which is like giving an alcoholic more alcohol or pouring gasoline on a fire. They already have too much insulin. They've already created damage from so much insulin.